My name's Sherry Wentworth and I'm an anatomist on the Bundoora campus. In this clip we're looking at the term anatomical relationships. Relationships as in how things relate to each other. In other words, where they are in relation to one structure or another. There is a principle that we're going to look at. The relationships of an anatomical structure can be described in terms of where it is relative to something else. In other words, what lies anterior to it, posterior to it, superior, inferior, and any other term you might think of that we've already given you. This is the anatomical relationships. So let's have a look at the actual terms we want you to use. The terms describing relationships are paired. We'll look at the idea of anterior or posterior. This can also be termed ventral or dorsal. As far as we're concerned, the terms can be interchanged. The next pair is superior and inferior. And again, we can talk about a cranial or cephalic and a caudal terminology. And what I'm going to be doing in a minute is actually showing you these so you can see what I'm talking about. But let's look at the list first. Proximal and distal, medial and lateral, superficial and deep, and the last term is probably a little tricky term, left and right. One you think you know very well, but we need to use it correctly within the anatomical relationships. So what we're going to do now is look at these relationships. We've just looked at the list of anatomical terminology we need you to know. Now we're going to look at what exactly do they mean. We'll start with the first pair, anterior and posterior. You might think of it as front and back. Anterior, the front anterior surface of the body. Posterior, I turn around and you've got the posterior surface of the body. Other terms we use are ventral, equal to anterior, and dorsal, equal to posterior. You might think of the dorsal fin on a shark, the top or the back of the shark. Next terms we think about were the superior and inferior. Superior towards the top of the head, inferior down towards the toes. If I talk about the terminology of cephalic, coming from the Greek meaning head, that's the same sort of idea. Caudal, also from the Greek, means tail, so that is equivalent to inferior. The next term we had on our list was proximal and distal. This is where we're talking about limbs. So an upper limb. I'm looking at the attachment of my limb to the axial skeleton or to my torso. So in this case, I have the attachment point as proximal, my fingers as distal. So we move down the limb from proximal to distal. The next term we want to look at is medial and lateral. Medial, middle of the body. So I'm looking at the middle of the body. Lateral, towards the side. So my upper limb, my arm, would be lateral. The next terms I need to use, my friend here, I'm looking at superficial and deep. Superficial, towards the skin, towards the outside of the body. To go deep, I would need to remove the skin. So if I look down deep, I now have the organs inside the body. So for example, I could say this bone here, which sat out here, the sternum, is superficial, the heart is deep. So the relationships we're starting to talk about are the idea of comparing one thing to another. Looking at the idea of relationships, of relating one organ to another, or one part of the body to another. So with the heart, it was deep to the sternum, which was the bone down the anterior or front of the body. My arm is lateral to that sternum. So I'm looking at comparing one thing in relationship to another. The last terms I want to talk about are two very simple ones you use all the time, right and left. The problem in anatomy is they can be quite confusing because it's the person's right or left that you are looking at, or the model's right or left that you are looking at. So you're looking at this model, can get confusing because this is the model's right. This is the model's left. Always with right and left refer to the model or the picture you're looking at, not to your own right or left. Have a think what would happen if a surgeon thought about his right and took off the limb that was on his right-hand side rather than the left limb that he was supposed to take off the person. So right and left are really important. Having looked at the relationships, what I need to think about now, or what you need to think about now, is how you use them. So what I'm going to suggest is a list, as you can see here, of structures. Now I want you to think about the relationship of that structure to another structure I've given you. The first example, the big toe, anatomically the hallux, is something. What's its relationship to the knee? Think about the list of terms we've just looked at and describe the relationship of the big toe to the knee. Work through the rest of them and then we'll come back and talk about the answers. So again, I want you to stop the clip and work through those questions. Right, let's have a look at the answers. Having worked through the questions, let's go and look at the relationship of the big toe to the knee. The big toe is distal to the knee. In other words, it's the furthest part away in the limb from the knee. Now, some of you might have given a different term. Some of you might have said the big toe is inferior to the knee. Perfectly okay as well. There are always a couple of relationships you can think about. Cheeks to the nose. Think about your face. So here's your cheeks, here's your nose. What's the relationship? Relationship can be described as the cheeks are lateral to the nose. Nose to the back of the head. So again, use your body. Here's the nose, going to the back of the head. The relationship, the nose is anterior to the back of the head. The head to the thorax. The head is superior to the thorax. The navel, or the umbilicus, to the small intestines. The navel is outside of the body on the superficial surface, so the navel is superficial to the small intestines, which are down deep.